I received a Facebook question from Becky regarding breast augmentation. And instead of using an implant, either silicone or saline, she was interested in potentially fat injections. And that is an option for breast augmentation, however, it's not very common. So fat injections is semi-new, and they're commonly used in the face, either separately or in combination with a facelift, and in other areas of the body, most commonly the butt, which would be the Brazilian butt lift, and now maybe a little more common in the breast. So the reason people don't use fat injections in the breast is because breast augmentation with either silicone or saline, number one, is easier and quicker, more cost effective, and a sure thing, which means you put the implant in and it's there. And the sizes that you can achieve are much more variable and larger. When you do fat injections, the whole theory is you're removing fat from one section of the body and then injecting it in a certain way back into the other section or other parts, hoping that it will become alive. In the face, where the face is much more vascular, the fat tends to last or stay more consistently because you're doing a small volume, meaning you might inject a teaspoon or so into each cheek, and a teaspoon's 5 cc's. When you're doing the butt or the breasts, that's a large volume of fat injection. So in the breast, for instance, you might try to inject 200 or 300 or 400 cc's, anticipating that about a third of that is going to go away, and sometimes more. And so breast augmentation with fat can be done. It's not as common because it's more costly and not as consistent with the results. And almost all patients will usually like a secondary fat injection or a touch-up to it or addition because the fat does dissolve. One area that fat can be used in the breast is to help with rippling from breast implants. So a thin person with a large breast implant can develop ripples on the front surface if the implant is placed in front of the muscle, which it shouldn't be. The implant should go under the muscle to protect from rippling in scar tissue. But also on the side. So in thinner women with a larger breast implant, sometimes they'll see visible ripples. So rather than having them gain weight, we can sometimes do fat injections to improve the appearance of the rippling. So yes, fat injections can be used in the breast. And one other issue is very commonly women who want breast augmentation are very thin. And so the actual donor site, or where we get the fat from, can be limited. So I hope that helped. And continue asking questions from Facebook or through our Facebook page or at our website, surgery@straightclinic.com.